I know. I know, but like I said, our doctors rotate, daily.
All right, so starting off from the top. Room 1 is a 35-year-old female. Came in a long time ago with flu-like symptoms. 2 is going. Bed 3, 61-year-old female who comes in off her meds for 3 days and chest pain for 3 days intermittently. Bed 10, room 11, room 15, 22 is signed out to me, sore throat that I just need to say hi to.
People who got into ER back when it was first starting chose ER because of the TV show or the media portrayal of it as an intense, high adrenaline, nonstop action world. I think, yes, the gunshot to the chest where you get to put in chest tubes and do all the critical care stuff that really gets your heart pumping. But I'll tell you what, refilling someone's diabetes and high blood pressure medicines is also a tremendous opportunity to prevent serious sickness. And if I refill someone's medicines, he might not come back and sit in the waiting room next month. And what was the plan after you left? What did they tell you to do?
They told me to follow up to this hospital.
Okay.
They released me without any type of medicine.
Okay.
I asked them, could I at least have something until I get some?
What kind of medicine are you talking about?
My high blood pressure medicines.
Okay.
So, but the response I get is, since I don't have insurance, they cannot provide that.
Okay.
I have to get it on my own outside.
Got it. Did they tell you whether you had a bleed stroke or a clot stroke?
Clot stroke on my brain.
Okay. And then what problems are you having now? Are you having a hard time moving your hands, your feet?
I've been falling.
You've been falling?
Yeah. Okay. I fall about 10 times.
Oh boy.
Sometimes make me laugh because.
I'm glad you have listened to me more about it. Do you have a doctor that you see on a regular basis?
No.
No. Okay. What medical problems do you have besides the stroke and the high blood pressure? Any other medical problems?
No.
Nothing? Okay. Any surgery?
This is my first time being in hospital.
All right, well, congratulations. Everyone gets there first.
Yes.
There's another patient that just came in that's pretty sick, but I'm going to come back and talk to you some more, okay? I need medical records for 15. He's diagnosed with a stroke, was kicked out the door and sent here.
Okay, 15.
So we need all of his records. EKG, CTs, MRIs, discharge summary.
MRI and discharge.
Labs.
DC summary.
All labs.
Labs. Okay.
And ED note. Thank you. I mean, I would if when I got him up to walk, I was actually kind of hoping to see that he couldn't walk, so that I had a guaranteed admission. But he can walk, so I can't force that on the medicine team. Well, the problem is there's no general medicine appointments till next March, so I can't let this guy slip through the cracks until next March. I mean, this is obviously a problem in our system, but someone needs to take responsibility for him. I mean, he had a stroke a couple days ago, and he's 44. He's got the rest of his life. So, any suggestions? I know you know that internal medicine side of the world better than I do, as far as appointments and stuff. If there's anything you can think of. Would you be willing to take him? That's fine. That's fine. Oh my God, you're the best. Unfortunately, we see a lot of patients coming in with very treatable conditions who don't have access to a regular doctor. I know that I can make someone better in the short term, but the ER is not the place to manage someone's overall health. It's going to require a heck of a lot more follow-up that I can't provide. So no medical appointments for the next couple months. So I just played basically a guilt trip on the neurology team saying someone has to take care of him, so she's going to take him in her private clinic in a month. That's the best we can do. We're going to take what we can get. How are we on beds?
We've been getting some floors and floors with tele. We're going to get one ICU. So I was thinking of sending the patient at 7 because they seem to be more viable than 8. I don't know, and we don't have orders for 8. This patient has orders and would be ready to go as soon as we got a bed. This person may have orders by the time we get a bed, and I'm not sure if they could take this patient because they may not have the staff. That's how it's been.
All right.
And we've also, we've had trouble getting the beds plus getting the orders, and, the house is full. So we're going to put some people in Hall 1 as well, get them in, examined, and hopefully discharged. Okay?
All right.
So that's that.
We'll do what we can.